Don Agnew is described as a self-made man who built an Edmonton construction company from the ground up, but his son says it was relationships with people that were his top priority.
He wanted to do his best and just be seen as a helpful person. And if there was a problem, he was always the first one there to try to find a solution.
In February of last year, Don was diagnosed with pancreatic cancer. He got biopsy results, but no follow-up with an oncologist. 3 months after the diagnosis, the Agnew family got a call to set up an appointment.
We received a call from Cross Cancer Centre about 10 days before my father passed, when he was in hospice. And, that's too late.
In Alberta, patients are waiting 3 or 4 months to see an oncologist to get started with cancer treatment. The target wait time is 4 weeks.
If you look at their scans that they've had, months ago, they were potentially curable, and then they come in and see you now, and now they're not. So it's truly a life or death matter for some of these patients.
Radiation oncologist Brock Debenham says a long-term investment in cancer care is needed. He points to BC as an example of getting ahead of the problem.
They've hired over 60 oncologists in the last 2 years, and we need a similar program in Alberta where we really say, it's not acceptable for a cancer patient to wait this long.
Alberta Health says the province has recruited 17.2 full-time equivalent positions this year, but doctors say over half of those hires are replacing people who have retired or left Alberta. The AMA says Alberta is having trouble retaining doctors, with pay being one of the main reasons. Alberta Health says work is underway on a new master agreement for oncologists. Despite the loss of his dad, Mark considers his family lucky. A friend in the medical community was able to help guide the family. Seeing an oncologist may not have given Don more time with his grandkids, but his family worries for others waiting for care.
If I hadn't had that network of friends to interpret the results and provide us with, this is what it's going to look like to the end, and this is how much time you have, I don't know what we would have done.
A report released last year shows that demand for radiation oncologists is expected to grow in Canada more quickly than future expansion in staffing levels. The report recommends more residency positions in areas outside of Ontario. Carolyn Curry de Castillo, Global News.